Okay, so this source is titled Prophylactic Chest Physiotherapy in Major Abdominal Surgeries Among Elderly Patients. So this is a randomized control study. It was published through the Journal of the Indian Academy of Geriatrics in 2016. It was done in a surgical ward of a tertiary care center, and everyone that helped publish this article was either a current worker or a resident for that unit. So the study was done with 50 participants, and they were all receiving elective abdominal surgeries, and they were all over the age of 60. This study did not take into account any previous respiratory complications that occurred, or if they were a smoker, or any of those factors at all. They just, as long as they were elective abdominal and over the age of 60, they were in this study. So they were placed into 3 different randomized groups, the first of which, Group A, was 15 participants, and these participants used an incentive spirometer prophylactically, and then 10 of them also did diaphragmatic breathing, and the other 25 did nothing to help prevent respiratory complications. So the patients were followed throughout their hospital stay. They did this pre and post-op, and the vitals were monitored, specifically the pulse ox, and then they were also monitored for signs and symptoms of respiratory complication occurrence. So the study then concluded that the complications did occur no matter what, but the percentage of occurrence was different based on what they did use to help decrease the amount of this occurrence. So incentive spirometer had a 40% occurrence of respiratory complications. And then the Group B diaphragmatic breathing, there was a 50% occurrence of the complications. And then the group that did not use any technique at all, they had a 72% occurrence. So almost 3/4 of that group had a complication occur because of this. So overall, both prophylactic treatments did benefit the patient and were better than nothing, but the study completes that the incentive spirometer is the better option here based on the percentages they gave. And then it just concludes with saying that they recommend doing another study, but it being in a larger population, not just this one hospital with one unit.